Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. Today we are going to talk about a very common and a favorite topic for everyone as well as a frustrating topic for everyone, obesity. Obesity, how are we going to define it? Is it anyone and everyone who is above the so-called normal weight zone? Well, of course not. So basically, we categorize obesity based on your fat distribution. If you're a lady, let's say that your fat proportion in the body is between 31 to 33%, then you will be termed as a overweight lady. If it is more than 33%, then we will be categorizing you as obese individual. Well, in case of male, the window is much more lesser. 21 to 25% of body fat is there, then you would be considered as overweight, and if it is more than 25%, then you would be considered as a obese individual. So these days we have different weighing machines that are available which can actually tell the fat proportion in your body. So based on, let's say that you're someone who's muscular, your weight is going to be on the higher side, then you don't have to worry about it. So let's say that you are an obese individual, your fat proportion is more than what is recommended. So how are we going to investigate? How are we going to see whether you have any risk factors? What are the problems you can face? For that, we categorize your obesity clinically by simple methods. One is your body mass index. So in which if you're going to be slightly overweight, then we will check whether it is because of the muscle mass or because of your fat. Or we have different options to check your weight, that is whether you're obese or not. That is by doing a skin fold test, by checking your fat composition in the body. We do a DEXA scan where we check again the proportion of the fat in your body. Now you are termed as a obese individual. Then we check what are the problems you can face. So we will be checking with your respiratory system. Do you snore in the night time? Do you have difficulty breathing? Are you wheezing a lot? So whatever I am mentioning, these could be the manifestation for which you have come to us, or these could be the associated factor which you wouldn't have realized, or this could be the complication that you're going to expect. So when it comes to obesity, it is just a spectrum. It can just be a risk factor, or it can be the presentation, or it can be the complication. So all of them have to be checked and it has to be handled. The reason for making this video is to make you realize that it has top to toe manifestation. Every single part, every single organ of your body is affected because of obesity. Let's say we are talking about your head, I mentioned, right? Psychological factor. It can result in depression, it can result in bullying, you might be body shamed, you might be affected because it gives you a low confidence as you are towards the higher side of the weight spectrum. Second, it's going to affect your breathing, not just with your lungs but also your nasal cavity, starting from your oral cavity. Every single part can be affected. You can have low immunity, you might be having recurrent infections in the heart. Of course, obesity is going to result in fat deposition in the heart, and you're going to have an early cardiovascular issue, whether it is the heart attack or a brain stroke because of this fat deposition. You never know, you might be at risk for any of these. Endocrine, thyroid can be the reason you are on the fatter side, or it can be the result of obesity itself. Cushing syndrome, where your steroid is in excess, that could be the reason why you're obese, or because of your obesity these hormones can change. In your joints, you can start having pain. Let's say you have an issue with your knees, osteoarthritis. It is because your body is bearing such heavy weight in that small joint, and the small bone has to handle the whole weight of your body. So that can be the reason. Your reproductive health, you can have anovulation, you can have polycystic ovarian syndrome, you can have a difficulty with the motility. All these things can again result in infertility. So your sexual health is again affected. Let's say in the gastrointestinal system, it can result in bloating, it can result in fatty liver, it can result in abdomen obesity, it can result in a lot of issue. Your motility, your movement can be restricted. It can even result in certain type of cancers. So it is not a single organ in the body that is not affected because of obesity. I've just stated a few of them. As a complication of obesity, you can develop diabetes, you can develop hypertension, you can develop cholesterol. All these things can again result in your liver disease, it can result in kidney failure, it can affect your eyes. So obesity is the starting point, and the end point can be a organ which is completely failed, or it can be a life-threatening complication. So how are we going to handle this obesity? So we will first start with your physical parameters. So we'll check your height, weight, BP and all, and then we will tell you where you fall under. Whether you are overweight, whether you're obese, or you are a morbidly obese person. Based on the value we get, we are going to chart out a plan for you. This involves from your side, from our side, both. So the cooperation is very much needed. So it goes in a phase-wise manner. First would be a counseling phase where we tell you what are the risks that are associated, how we are going to work on it. Second is the initiation phase where we are starting the treatment and we are going to maintain it. That is the last phase. Usually maintenance is the ideal would be at least 1 to 2 hours maintaining, so that you can have it as your lifestyle and follow it for the rest of your life. So in counseling phase, we tell you about the lifestyle changes that we want from you, like the physical activity, which is a must, about your stress levels, how to handle it, about your sleep quality. Then we give you a diet chart, what you have to follow up. It is not as simple as this. We tell you to maintain or measure your neck circumference. We tell you to measure your abdomen circumference, waist circumference, hip circumference, etc. Not just the weighing scale. So all these things you would be monitoring and telling us. We'll also be asking you about the quality of life. Is there a challenge when you're doing an exercise? Are you breathless? Are you having any aches and pains? Based on that, we'll be modifying. Portion control is very important. Timing of the meal is very important. So we will be guiding you on that. When it comes to us, we will be starting you on a pill, and we might have to use multiple pills. We will be explaining you about the side effects, what are the changes that are expected. If nothing works, then we will be giving you a surgical option. So when we are monitoring, we won't be just targeting on the weight loss. We will also be checking the other parameters. Let's say that today is day 1 of your initiation. I'll be calling you after 3 months. At that time, let's say that your sugars were slightly on the higher side and your cholesterol was slightly on the higher side. Then I would expect you to lose 5% of your current body weight, as well as an improvement in your sugar profile and your cholesterol profile. So it is not a single visit, it is actually multiple visits. We will be going on this journey with you. So let's say that I have put you on the lifestyle changes and you have followed it for about 6 months. There is no improvement. Then today I'm going to start you on the pill. That is, after 6 months, I'm going to start you on the pill. So with pill, we will be again following you up for about 6 months. So again, there is no improvement or there is a deterioration in your condition. That is when we will be providing you with a surgical option. So it is not just a single visit and we immediately ask you to go for a surgery, until and unless you have a severe morbidity or it is life-threatening, where surgery is the only option where I can save your life. That is a situation where I'm going to suggest you a surgery. Again, the surgical options are multiple. It can be a simple surgery where we will be just doing a liposuction, that is removing the excess fat by a simple procedure, or it might involve a major surgery like a bariatric surgery. So again, that depends on you, your manifestation, your current health, as well as the response that we have received based on your lifestyle changes and medications. So it is a continuous journey. It is always better to treat your obesity at the earliest. Treatment does not always mean surgery or medication. Even your lifestyle plays a very important role in treating. As long as we are physically active and following healthy lifestyle, we will be able to control this epidemic, I would call it, because obesity is a big challenge now. We have nearly 35% of Americans suffering from obesity. It is not just a developed country problem now, it is even seen in the so-called developing and so-called underdeveloped countries as well. So let's all work together and create a healthy world. I hope this video was useful. Follow me for many more interesting medical videos.